Hey everyone, I wanted to talk about phlegm versus snot. As I was driving my son to school today, he was coughing up these big loogies, and he said, "Hey Dad, this color of my phlegm is the same as my snot. Is it coming from up here or down here?" So I explained to him how this works, and I thought I would explain it to you guys. So when somebody has a problem, or whenever we breathe, we usually breathe through the nose, unless it's totally blocked up and then you become a mouth breather. But we're made to breathe through the nose, quietly. And there's a lot of things in the environment, including smoke or incense, pet dander, allergens in the air, sometimes dust mites, materials that come from clothing. All these things are invisible, and they do get inhaled, and when they get inhaled they can act as irritants. So what does the body do? It makes a filter system in the nose, millions of tiny hairs that line almost mountains of tissue. That's what usually prevents crap from getting into the lungs. Now if you think of the lining of the nose as a doormat, the doormat is supposed to keep you from dragging dirt outside your house to the inside of the house. You wipe your feet on the doormat, you walk on in, all the crap is kept on the doormat. And what do we do with the doormat? You clean it every once in a while, otherwise if it gets too caked up, it won't work as a doormat and you'll bring dirt into the delicate house. Same thing with the nose. The nose usually will have millions of hairs, and then those hairs will have a little bit of sticky secretion, so that if the hairs trap particles as you breathe air in, if they trap particles that are invisible to the naked eye on the hairs, and those little particles, whatever they may be, come in contact with the secretion, you now have a ball of phlegm or a ball of snot. Now, if you don't clean out the nose every once in a while, the balls of snot will just accumulate and you'll just have a big bucket of snot in the nose. So what do? We sneeze. It forces all the air out quickly through the nose, kind of like shaking the mat, and you get all the loose stuff out. My suggestion is you use water like a neti pot, and I have talked about what to do with the stuffy nose before, whether it's a neti pot, nice gentle saline rinse, or whether you cowboy it and you hold your hand underneath the faucet and you sniff in water from the tap. I wouldn't do that. I would usually say bottled water is safer. But whether you do that or not, it's better than just blowing your nose with a tissue. So the idea is when you wet all those secretions and those particles that have been trapped, then it makes it a lot easier to dislodge and blow out when you blow your nose. If it's all dry or the secretions have stopped from like 6 hours ago and the particles are still there but they're trapped and crusty, it might not come out when you blow your nose with a regular tissue. So that's the reason for wetting. Almost like steam vacuuming your mat so you have a deeper cleaned mat so that everybody else can use it. So that's the way the nose works as a filter. And it protects the lung. There are other protective mechanisms into the big tubes of the lung, kind of the same as the nose, but if we can trap all the crap up here, all the irritants, all the allergens, all the pollutants up here before the lungs have to work on them, what a better way to get through the day. Sometimes what happens is when you're exposed to tobacco, whether it's smoke from incense, smoke from burning fires, tobacco, sometimes those cells in the lining of the nose or the chest, they stop working. Either the hair cells don't work properly or you can't secrete what you have to as far as liquid to trap those little particles. So the filtering system doesn't work that well. So that's why some people get sicker than others. It's always a good practice to clean out is the bottom line. The snot that you produce from that filter system will either go out the front of the nose or it'll go down the back of the throat. There's only those two ways that it'll happen. So if you blow it out this way, then you don't have to swallow it this way, because when you swallow enough snot, it'll actually either line the vocal cords because it's sticky, or it'll upset the stomach and can irritate the stomach and give you diarrhea. So you want to get that stuff out. Plus remember, some of those things that you inhaled that you're supposed to be blowing out are irritants. If you expose the gastrointestinal tract to those irritants, you'll still manifest the reaction. So that's what I would do with regards to a normal, healthy practice on how to keep the filter clean. If you have excessive amounts of snot, no matter what the color, yellow, clear, green, you might want to get checked for allergens in your environment. You might want to move. You might want to get your dog taken care of. You might want to get rid of your cat. You might want to stop smoking. Whatever it is, if you have more than usual and it's all year long instead of just at the change of season, it's time to get into your doctor's office and see if there is a reason for that. Worst case scenario, sometimes you can have a problem with the lining changing, and it's a warning sign. There are some herbs that you can take that sometimes help with the allergic type reaction. I like butterbur, echinacea. Sometimes mullein will help with loosening up phlegm. Then there's always the over-the-counter medicines. Decongestants will help decrease swelling in the lining of the nose. And then mucolytics that you use for the chest can sometimes loosen up mucus or the phlegm so it's easier to sneeze out. The nasal sprays that are available, whether it's a steroid nasal spray or an antihistamine nasal spray that are coming out, and there's a couple that are coming out nowadays, they both work if the lining is clean. If you don't clean out the nose before the nasal sprays, whether it's a vasoconstrictor, a steroid, or an antihistamine, you're just spraying snot, so you're losing the effectiveness of the medicine. So try to always clean out the nostrils first and then use the spray up to 2 to 3 times a day, depending on the prescription. Last but not least, sometimes discharge from those can actually be from infections in the sinuses. There are several sinus cavities, the maxillaries, the frontals, the ethmoids, and the sphenoid sinuses. Those cavities are like caves that have one way in and one way out. And if the nose is all blocked up and swollen, these things won't be able to drain, so they'll cause pressure and buildup and pain. Better functioning of the sinuses, so they're always draining out and emptying the bacteria or the discharge that they make, would be if the nose is functioning properly. If it isn't, you treat it. If it still doesn't work properly because it's blocked up, then you need the surgery to open up the passage a bit. Sometimes phlegm or snot dropping down the back of the throat will line the vocal cords. It'll give you that reason to go all day long. And that too is usually from postnasal drip. Gets worse when you lie back, gets worse when the season's bad, but it doesn't necessarily mean that there's phlegm coming out from here. One way to tell is to get to the doctor's office, have us take a look in the nose, have us take a listen to the chest, and make a determination. If you did all this and you still have a problem with that need to clear the throat, then it might be that you have a problem with the chest. And that's where the phlegm part comes in. So phlegm can be just produced in the lungs. The lungs, at least the big windpipe here and the small bronchus here, they do have these little hairs just like the lining of the nose, and the hairs all beat in one direction to push phlegm and particles upward and out so you can hock it up. So usually the same things that cause irritation to the nasal passage can cause irritation to here. If you smoke, you have less clearing potential than if you don't smoke. If you don't take enough fluids, the secretions in the chest that are supposed to trap particles won't be as thick and won't be able to trap so you can hock it out. So thus the reason to stay hydrated all day. Sometimes there are things like asthma or reactive airway disease or bronchitis that can occur. If it's asthma and you have that need to clear all the time, sometimes it actually needs an inhaler as a test dose. Use an inhaler. If that need to clear your throat goes away, then it's probably an asthma-like reaction. That you need to see a doctor for. I wouldn't do Primatene Mist. I think they stopped selling that over the counter. Essentially you have to get an inhaled medicine through your doctor's office. But that might be a way. There is a fancy test called the Methacholine Challenge that will tell whether you have hidden asthma or not, or exercise-induced asthma, or just plain old reactive airway disease. But if that's the reason, that's easy. If it's not that and you don't respond to an inhaler, then it might be bronchitis. If it's bronchitis, that can be any irritation to the bronchus or the big tubes from smoking, from infection, from cold air, from just irritation, say dust mites, work, or some toxic exposure. If that's the case, you get away from the toxic exposure and you should be okay. You clear out the secretions better, you should be okay. Sometimes it takes us taking a listen and listening to the qualities of the breath sounds. Sometimes it takes us as doctors getting a chest x-ray. But either way, if you use things like mucolytics, there's guaifenesin. Guaifenesin breaks down phlegm and makes it easier to hock out. and it makes it not as irritating to have to cough all day long. If it's easier to get the phlegm out, you just cough once an hour, it should be okay. If you're producing way too much phlegm, even with or without that mucolytic, that might be an infection, so again, it's worth a checkup. Sometimes there's dextromethorphan, which is also over the counter. Some over the counter syrups have both dextromethorphan and guaifenesin. It doesn't really matter. Sometimes dextromethorphan just calms down the irritation to the bronchus so you don't cough as harsh. The bottom line is you should get all those irritants out of you, but if it interrupts your sleep or interrupts your work, not be socially acceptable, thus the reason for trying mucolytics or cough suppressants. Though for the worst cough, we also have narcotic cough suppressants. So that usually makes you tired, constipated, and can give other symptoms, especially as far as addiction, so you have to be careful with codeine. The phlegm that you might cough up can certainly be the same color as a snot that you cough up, but as far as whether it's primarily a nose problem or primarily a lung problem, it really takes a doctor to help you figure things out and apply the most appropriate treatment plan. You can certainly shotgun treatment, treat everything this way, and hopefully you get better faster. If you look at my video on DrRic tutorial cold and flu, you'll see my usual go-to rescues for infection exposure. But this video is mostly just to talk about irritants. Irritants to the nose that you breathe, irritants to the chest that you inhale. Worst case scenario when it comes to persistent cough or problems with the lung, I think it would be helpful to use eucalyptus or menthol to these spots on the shoulders. These are the lung points in acupuncture. Sometimes makes things get better faster. Or to the chest or to the soles of the feet twice, 3 times a day. Those are essential oils. I think they're just as powerful for calming down the lung. But as far as persistent symptoms, even if you're getting better with over-the-counters and herbals, it's always important to visit your doctor just to make sure that you're not spreading an infection that could have been stopped immediately. I don't always agree with antibiotics. If somebody winds up giving you an antibiotic for a sinus infection or a bronchitis, please remember always do a probiotic at least for 30 to 60 days, if not for the rest of the year, as you have to build up the bacteria that we killed inadvertently to the gut, the vagina, the skin, and that's usually with a good probiotic. See my video on probiotic. Hopefully this helps. Give me a thumbs up if it did. Otherwise, stay tuned for weekly words of wisdom.